And this just in, the Kansas City, Kansas School Board is voting to move the start date of in-person classes to April 5th. The original date was in January. The district has been all online since the start of the semester, September 8th. There will be more information on the district website by tomorrow morning. A COVID-19 vaccine isn't here yet, but we know tonight who might get the first doses. And a Kansas City doctor was one of 14 people on a special CDC committee deciding just that. The vaccines are coming, just weeks away, maybe 40 million doses in the beginning. And this OBGYN at the University of Kansas Medical Center was part of the group making a big recommendation.
So phase 1A is healthcare workers and residents in long-term care facilities.
Dr. Kevin Ault is one of 14 members of a CDC panel voting 13-1. Healthcare workers and those in long-term care centers should be first in line.
The reason long-term residents of long-term care facilities came to the front is the tremendous mortality in that group. It's, I think we said today, about 100,000 deaths in that group in the United States. Very vulnerable population. Vaccinating both the residents and the people who take care of those vulnerable patients.
The panel didn't endorse any particular vaccine, and they're waiting to hear more on how effective and safe they may be.
I think the choice is difficult because we don't have the data from the phase 3 trials.
Dr. Ault has been on this panel for 15 years, and they've been talking about today's vote since July. As federal regulators make decisions on which vaccines will be out there first, Dr. Ault says there'll be many more meetings just like today. And it's those meetings where decisions will be made on who gets a vaccine next. As for the definition of a healthcare worker, Dr. Ault says it's broad, basically anyone who cares for a patient. And with only so many doses available in this first phase, hospital officials will have to decide who on their staffs will get the vaccine first. Dr. Ault says the panel suggests perhaps staggering vaccinations by groups, like those in the ER and anyone who has direct contact with a COVID patient. A new report offers troubling facts about the way area nursing homes are handling the virus. Missouri and Kansas have more COVID cases in nursing homes than the national average and more nursing home deaths per 100 residents. Former Kansas governor and state lawmaker from Olathe, Mark Parkinson, now helps run the American Healthcare Association, and he applauded the CDC decision on a vaccine today.
If we can pull together as a country and in the next 60 days vaccinate all of these residents, we can cut the death rate almost in half.
And with millions of doses of the vaccine on the way, doctors are already confronting skeptics tackling disinformation. As our Haley Harrison finds, it's the next public health challenge.
With coronavirus vaccines in production, the end of the pandemic may be in sight.
I think we should all be really happy and hopeful and finally kind of see the light at the end of the tunnel.
But first, the University of Kansas's Brett Bricker tells me we'll face another challenge.
There's a portion of the American public that no longer has faith in medical or governmental institutions.
Long before we heard of COVID-19, Bricker started studying the anti-vaccine phenomenon.
Although proven safe, vaccines are the target of conspiracy theories. Bricker says it's because they're preventative.
I think that's a pretty significant difference in the way that people approach vaccines versus the way that they would approach like going to a doctor. A lot of people that are anti-vaxxers are not anti-doctors. I do have faith in the facts in this case, but that's not going to work on everybody.
But there are those who have reasonable questions. And that's why the University of Kansas Health System is dedicating its morning briefings next week to answering your questions about these vaccines, dispelling rumors, myths, and misinformation.
I have faith in the American public to make the right decision when they've got their questions answered.
Haley Harrison, KMBC 9 News.
To ask a question about COVID-19 vaccines ahead of next week's panel, email the address on your screen. Next week's briefings will include Dr. Kevin Ault from that CDC advisory group, a doctor from the Mayo Clinic, and Kansas Senator Jerry Moran. And keep these dates in mind. December 10th, the FDA will consider Pfizer's application for an emergency use authorization. December 17th, the FDA will consider Moderna's vaccine candidate. Experts say it may be spring before vaccines are widely available in the U.S.